Is now via Skype. Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thank you very much for being here today.
Thank you.
When I saw the numbers this afternoon, I thought, what would Jamie Swift say? And I thought, it's probably not good. I'm thinking you're probably a bit concerned when you see these numbers. What's your read on the data today?
Now, I'm extremely concerned about what we're seeing. Our region is at a new point in this pandemic. We have to remember back when we had those numbers at the beginning of the pandemic, we were really seeing that as a lot of it related to travel and clusters and groups. And what we're seeing now is just widespread, community spread throughout the entire region. I'm extremely concerned, and I really hope people understand that it is time that we adjust our behavior, regardless of mandates, regardless of laws or recommendations. It's time that our community has to really step up.
Now let's drill down into why you're concerned here. You're saying before you were seeing clusters. That would be people maybe who went to New York or to the beach or whatever, and they were together with a lot of people, then they came home. Or you were seeing clusters in, say, prisons or in nursing home communities or things like that. Your concern is now that it's just way more prevalent in the community than it was before. Am I getting that right?
It is. We're seeing every indication that there is significant virus circulating in the community right now. So, what we're seeing are just individual cases who don't really know where they got it. They don't remember being anywhere in a large group, or specifically concerned people in the public sector. So those people who work in retail and banks and various places that we're starting to see that have that interaction with the public. We're starting to see a lot of public sector employees getting infected. So it's really, it's in our community. It's certainly spreading quickly in our community, and we really need people to adjust their behavior.
And for some people, and we've been saying this for months now, for some people they don't even know they have it. For some, they know they have it and it's minor and they're over it pretty quickly. But for some, it leads to critical illness, and for some, it leads to death. Is your concern that this spike in new cases we're seeing now going to translate into a surge in hospitalizations, which seemed to happen before? Are you worried that that's going to happen in 2 weeks, 3 weeks, 4 weeks down the road?
We do suspect that we're going to see an increase in hospitalizations. We're working record number of cases almost daily now. We're seeing the cases in all ages. So we're starting to see, some of our elderly who test positive just from the community that aren't even coming into the ED. They're just going through a drive-through. So we know that all ages. So typically, I think we talked about last week, you'll see that early peak in the 21 to 30-year-olds, and then you start seeing the peak in the elderly, and that's when your hospitalizations really start going back up. And I'm afraid we're headed there if we don't do something. Okay,
you mentioned behavior modifications, and you're talking to people. Let's get past the mandates. This is about an individual decision. I understand that you're asking people to make, but we have schools are back in session. We have sporting events that are taking place. Families are trying to resume normal life. Businesses are trying to stay afloat. What are you talking about? I mean, what do you think needs to be happening here?
I think families and the region as a whole just need to come together. I think you need to really plan about where you're going. Think about if the place you're going is following the guidelines, masking, social distancing. If those things are in place and you can safely go, then okay. But if you get somewhere and it's a large crowd and the majority of people are not masked, I would leave. The risk is just too great. And again, even if you're one of those people that doesn't end up in the hospital, you may never know just how far down the chain your infection affected others. So, that's what people don't see, is just how far that they may have spread it unknowingly. And that's where we get into these rapidly increasing numbers.
So I think for a lot of families right now, they're trying to plan, we've already kind of done the school and sport thing, but for many it's the holidays and Halloween and family gatherings, and where am I going to be over the next few months when we are all just love to be together. So what's Jamie Swift saying? Are you trick-or-treating?
Thankfully, my kids are too old to trick-or-treat, so that is not a battle I have to fight this year. I think people really need to find alternative events. Certainly there may be safe events out there. If not, just stay home. But, find out what the guidelines are. If it's somewhere that a kid is going door to door in large groups, walking around, I would not participate in that. So I think we're going to have to be really careful. I'm going to go home tonight after the numbers that we've worked today and have a discussion with my family about some behavior modifications we may take.
You're really concerned. I mean, I know this is your job, but I've known you for years. You seem troubled by this.
I am. I mean, at this point in the pandemic, I would hope that we could really start slowing this down. And I know people are tired, and I know they're probably tired of seeing my face and hearing my words and the same things. But, our healthcare workers are exhausted. I'm asking for the impossible from my team and from our nurses and all of those things. And we need our community to help us slow this down.
For the record, we never grow tired of you. Thank you, Jamie Swift with Ballad Health. And thank you so much for your information, as always. We appreciate it.
Thank you.